social care and health. Thank you.
Thanks, Yvonne. Hopefully you can all hear me. Yeah? I'm really pleased to welcome you here this morning for a number of reasons, which I'll explain to you. But I'm going to introduce the session here with Jim Smith, who's the Secretary of WISL, the Worcestershire Coalition for Independent Living. So we're doing this as a joint exercise, as part of co-production in practice. And co-production here in practice means that Jim's told me I need to do most of the talking. So that's, I suppose, where the power should lie. And the other reason I'm particularly pleased to welcome you, along with Jim, is it's actually my last meeting here in the council. I leave next week. Thank you. Thanks very much, Fred. I leave here next week, and hopefully I'll see a number of you at my leaving do next Monday. And if you haven't got an invite, hopefully either one's on its way, or just invite yourself next Monday at 12:30 in this room. So it's my last meeting, and I can't think of a better way of ending my career here in the County Council in terms of chairing a meeting that's to do with service users, the council, the voluntary sector, all working together to improve community-based support for people who need social care and health services here in the county. So I'm really privileged, I think, to have been invited to launch the session here with Jim this morning, and it's a great way for me personally to finish off 12 years here working in Worcestershire. So why are we here? The key words up there about making it real. So we're here about personalisation in health and social care, and making it real is about how can we all work together to put words and policies into actual practice and into people's lives so that service users and carers benefit from a more personalised, bespoke support that you have greater control and choice over. Now those again are words, and the key challenge that we've all got is putting those words into practice, and that's what making it real is all about. There are 6 themes or markers for making it real. Things like information advice, active and supportive communities, personal budgets, I won't go through them all, and flexible integrated care and support, but there's 6 criteria or markers then that we need to measure ourselves against here in Worcestershire. And around the country, similar areas are doing the same. And I think Yvonne told me that I think there's 422 organisations signed up, as we now are, to making it real. So it's about working together, and nationally making it real is led by 30 national organisations encompassing health, social care, government, the voluntary sector, and also care service organisations, the private sector too. So it's all about us working together in co-production to make sure that we share our influence, we all contribute, and we all agree a way forward about how making it real can be shaped and laid out here in Worcestershire. Because we need to look at those 6 areas I've mentioned and make them a reality here in Worcestershire. So how can we make services more flexible? How can we improve choice and control? Doesn't mean we're starting from scratch. We've done a hell of a lot of work already in Worcestershire, and 10 years ago, over 10 years ago, we had less than 90 people with a direct payment, and now there's nearly 1,000 people with a direct payment here in Worcestershire. So that shows the journey and progress that we've made. 10 years is a long time, however, and personally I'd like to see that 1,000 that we've nearly got now using direct payments, I'd like to see it triple. and I'd like to see it triple within a year. Now, that's a massive challenge, a massive ask of all of us. But it shows, I think, together, we can increase the pace of change. But that pace of change needs to be helped and determined by you in this room and by colleagues and friends elsewhere who aren't here today. It's not about me or the County Council saying this is what we should do. It's about saying, what are our ideas together? What sounds good? What doesn't sound so good? What are our priorities? So this morning you will be looking at what commitments should we make in terms of bringing personalisation into reality. What do we need to change and improve further and build on what we've done? What should be out of all those commitments, what should be the priorities that, again, we agree? Not one group of people saying this is how it's going to be, but trying to do that together. And that's, I firmly believe that strength will then come from us doing it together, where people don't feel it's imposed upon, that they've had no choice, they've had no say. So this is your opportunity to have a say and to make sure that you have as loud a voice as you wish, whatever that, however loud, however long you want it to be, individually and collectively. And I encourage you to keep having that voice and that say from today onwards, because we need to make sure that making a reality isn't a one-off, that it's something we continue to work on together. So please do ensure you contribute fully today. Please do ensure you contribute fully in the future. If you don't like what's happening, shout out. We all need to listen to each other. We all need to learn from each other. And by doing so, we'll make a much better job of it. You've got things to contribute. You've got ideas. You've got skills and experience that I haven't got, that Yvonne hasn't got. So we do need to all work together and bring all of our expertise and experience into a combined approach to make sure making a reality becomes exactly that. Not a piece of paper, not just a policy, but something that you can point to and say, yeah, we agreed this has now happened, this is what's changed and improved, and life for everyone here in Worcestershire is much the better for it. Because that's how we need to measure our progress. How do we improve the quality of life of people who need health and care support here in Worcestershire? And it's that quality of life and the promotion of independent living by which we should be measured as regards the progress. Not just numbers of people on direct payments, absolutely not. Numbers are important, but ultimately it's about the quality of life. I did some interviews on Friday, and this was to do with actually replacing Catherine Driscoll, who left us unfortunately a few months ago. So the head of health and social, the head of adult services, adult social care post. Unfortunately, we didn't appoint, so that was very disappointing. But one of the candidates, when we interviewed them, said, "People want a life, not services." And that was a really good way, I think, of me finishing off in terms of my introduction to you. That's what we should be about in this room, helping people have a life, have a good quality of life. It's not about defining what services might need to be increased or there be more of. Yes, that's part of it, but our goal has to be, how do we improve the quality of life and help people have a life here in Worcestershire? That's all I want to say by way of introduction. That's on behalf of Jim and myself, but Jim's now going to also say a few words by way of us co-launching this morning. Thank you very much.
All I'd like to add to what Eddie said is there's a bit of a challenge to this. If service users, carers, professionals from the voluntary community sector are going to work in partnership with the County Council and other agencies, we've got to stand up to the plate and help the delivery. And that's important. Some people have given their apologies today for personal reasons. Some from the VCS said we just can't afford to come. So there's a lot of work for us to continue to do. The other aspect of all this, and Eddie alluded to it, is health, transport, housing, all of which are services not run by the County Council Social Services, are important factors. So in moving this forward, although we've got a big agenda with the County Council, we also have agendas to work with other statutory and voluntary sector agencies in the county to make sure that the jigsaw fits together. I'd like to add my personal thanks for Eddie for collaborating on this. He announced his last event a few weeks ago, and he jumped at the opportunity, to be frank, because he was keen to see it happen, to come along today. But it is significant that it's his last public event as a director. And to acknowledge that, Jackie and Winston, who are the co-chairs of Whistle, the Worcestershire Coalition for Independent Living, are just going to present Eddie with a little memento, so every time he has a cup of coffee. Whistle wouldn't have got going without support from the department. I also need to acknowledge people like Bernie and Winston, because WASU was a formative part of Whistle. It's no more, it's moved on, but the heritage of WASU has come forward and is being added to by other partners. Yeah, Jack.
Right. Yes, my pleasure, Eddie, to give this small token in our appreciation for your services over the years. I'm sure it wouldn't go unrecognized, and we hope that whatever you do in the future, it will bring you as much pleasure as your previous job. Thank you.
But it's really important to me to receive an acknowledgement of some of what I've contributed here, I hope, in Worcestershire, and helping everybody else make it a place where people can feel that they are valued and can play an important role. So I really appreciate that, Jackie and Winston. Thank you.
I think I've got nothing more to say. I'd better pass over now to Von.
Okay, thank you very much. Can everybody hear me on this mic? Yeah? Okay. As Eddie and Jim have said, this morning is about all of us in this room working together, so I don't want to take a long time over a presentation, but I just thought I'd set the scene about personalisation and the making it real, just in case people aren't familiar with the Think Local Act Personal Making It Real programme. So I'm just going to run through a few short slides, and then we're going to get on to the real work of the morning, which is us all working together on some of those actions and priorities that we want to take up. We will be having a short break. As I say, you've got facilitators on your table who will guide you through the exercises. We're going to, after my presentation, go into a short exercise, and then there will be a very short break for some refreshments. I'd like to thank Whistle for supporting us with the refreshments. As you know, we don't have much money in the council anymore, so thank you very much to Whistle for doing that. They'll be back at the back of the chamber. And then we will come back for some further group work and then a short sum up at the session about 1:45, and we will be finishing at 2 o'clock for the event. I've just realised that it says on my sheet here that I haven't introduced myself. I don't think I have I? Okay, Eddie mentioned my name. I'm Yvonne Reeve, the Personalisation Strategic Lead. Very recently come into post, actually, and following on from Annie Dixon, who a number of you may have worked with in the past. So, personalisation and TLAP, as it's known, or Think Local, Act Personal. The personalisation agenda, as I'm sure many of you know, started back in 2007 with the Putting People First agenda, and in there were 4 key areas for us to think about of universal services, social capital, choice and control, and early intervention and prevention services. And so that agenda's been running for quite some time. At the end of March 2011, Think Local, Act Personal, that's a partnership organisation, took over and progressed further with the Putting People First agenda. And in particular, as Eddie's already said, they were very keen to allude to the fact that we need to make sure it's real for people experiencing services. There's many, many papers and documents and pieces of paper that talk about personalisation, but the real value is going to be when people are living it in their lives and experiencing it properly for themselves. So the Making It Real is one of the key pieces of work by Think Local, Act Personal that they're asking all organisations to take up and sign up to and action plan in their own authorities. A number of local authorities have done it, but as Eddie alluded to, there's 422 organisations. You don't need to be a local authority to sign up to this agenda. You can be any organisation you like, and the more organisations, the better, the more we would encourage. So what is Making It Real? Well, basically it's a way to mark progress on personalisation. It's a set of statements, and the statements have been developed with a number of partners, with people who use services, carers and other citizens, who say that if these statements are in place, then I will know that personalisation actually means something to me. There's a number of things that need to be put in place or put into practice in order to support those statements, and we're going to have a look at those things this morning. And the whole programme itself is just that. It's a programme for working together. It's a tool that has been designed for us to use and work together to decide what we need to do most in Worcestershire first. So we do need to identify an action plan, and some of the discussions this morning will help inform us about that. And then when we've got the action plan, we need to make sure that people know that what we're doing about that action plan. So we regularly have to update about what's happening. There are 6 markers of progress. There's information and advice, having the information I need when I need it, active and supportive communities, keeping friends, family and place, flexible integrated care and support, which is my support, my own way, workforce, having the right workforce and my support staff, risk enablement, people feeling safe and feeling in control of their lives, and personal budgets and self-funding, so people having control about their own money. As I said, these are broken down into 6 further I statements, and this is just an example which is a bit difficult to read on the screen, but it's from the workforce section that just has those I statements that people have developed together. So you would have, for example, with workforce, I have good information and advice on the range of options for choosing my support staff. So personalisation would be real if you were able to say that here in Worcestershire. I have considerate support delivered by competent people. And those, as I say, those I statements have been developed by people who use services, carers and citizens. Underpinning all the I statements, there are a number of things that need to put in practice. And again, this is just an extract off the Think Local, Act Personal website. You do have some papers on the table, just for reference, which goes through these I statements a bit more detail. But I would encourage people to go onto the TLAP website and see some of the documentation on there. Explains it more. So the things that need to be in place, so same with the workforce example, the workforce is supported, respected and valued. They have easy and accessible processes to enhance security and safety in the employment of staff. So you can just see there's some practical things that need to be in place to make sure that the I statements can be delivered. So what do we need to do to be part of the Making It Real programme? Well, we need to register on the TLAP website. We've already done that. We did that back in February. And certainly that's when Jim and I started talking about getting yourselves, from particularly in Whistle, involved in moving forward. We may need to make a board-level commitment, and Eddie's already done that with the Senior Directorate Leadership team, so that step's completed. And we need to involve yourselves in moving forward. So that's our first step here this morning. We produce an action plan. Out of that, we identify 3 top priorities, and then we report on those publicly on the TLAP website about what we're doing, and give a progress update every 6 months. And of course, if we crack all those priorities, we go on and do some more. So what are we going to do this morning? Well, there's 2 parts that the action plan for making it real have. One of them is about looking at commitments, so that's going to be the first exercise. We're going to have a look at the commitment statements around making it real and see how well we're doing against them. As I said, we'll have a bit of a break, and then we'll go on to discuss the I statements. And every table has got a different theme to discuss, so you'll be having a look at those with your facilitators this morning, and then we'll briefly sum up with 1 key priority from each table. But all the work that we're doing will be taken forward, and we'll identify priorities that you say here this morning you think we should be focusing on first, and we'll put them into our action plan. So after this morning, when we've collected all the work together and you've told us what the priorities are, there is a small working group, some names already identified, but if there are people here who are really keen to be involved, please let us know, because the more people we can have involved, the better. We'll work up the action plan, we'll put it on the website, we'll be looking for yourselves to tell us whether we're actually doing the actions right and getting it in place. And as I said before, we will report on them. So that's me. As I say, I just wanted to do a very short presentation. Is there any sort of any questions that anybody's got, anything they're not clear about before we get into the real work of the morning?
Is the presentation available electronically?
Yes, it will be sent round electronically, yeah, after the event. We'll do. And also, obviously, you'll have the podcast to see as well. We won't be recording all the group discussions. We're just doing this bit, and then we'll... Yes, that will be available as well as the podcast. Yeah. Any other questions? Okay. Well, we're slightly ahead of time, which is great because it gives us a little bit more time for the next exercise. So we're going to have about 30 minutes. Your facilitators have all got the instructions about how to go forward. Then we'll have a short break after.
How do we want to, we haven't rehearsed this, have we? So how do we want to manage the key points, Winston?
I think we'd like to get the tables what they consider to be their key points, and then maybe follow through on that.
Okay.
So table 1, what would you consider to be your key point?
We would expect Worcestershire County Council to listen to what we want, to provide it in the way we want it, and inform us who we need to speak to if we're not speaking.
Is that 3 priorities or 1? Okay.
Okay.
Can I just interrupt? Sorry, we've just had our media person here. Angela's not really media, but we need to go up the front here, if that's okay, because we can't get you on the podcast. We can hear you, but we can't see you. So can you just bear with us a minute? We're just going to manoeuvre ourselves this way. This is giving you time, Eric, to decide whether you've got 1 priority or 3 while we make this transition. Yeah, I know you're of old, Eric. That will be fine, thank you. Just here, so that we can capture your lovely selves on the podcast. Do you want to come in front of the table, Jackie?
Just stand in front of the table. And Winston, if you're okay to come up here. Is that all right? Yeah.
Okay, I'm assured by our media and communications, as of today, person, that we're now on podcast, so that's great. Okay.
shorter sentence, please, Steve.
Thank you.
The sentence is now, I would expect Worcestershire County Council to ensure that I am in control.
Excellent. I'm sure we'll all agree with that. Table 2?
Table 2.
Wake up, Don.
We felt that the second one was the most important, the considerate support delivered by competent people. Because we felt if that was done, the rest would fall into place naturally. But we did stress that the support should be competent and considerate.
Is the consensus on table 2 that's lacking?
I'm sorry?
Is the consensus on table 2 that support is lacking in generally?
The general census of opinion was the information is available, but its distribution needs attention and to be publicised.
Yeah. Excellent. Jackie, you try to jump in when you want to. Okay. Table 3?
We said that it was, I feel safe, I can live the life I want, and I am supported to manage any risks. We talked about the importance of feeling safe and having confidence in the staff that were looking after you.
I don't know what more can be said about that. I think most people, well, everybody would like to feel safe and go about their daily lives, in confidence. So, yeah. Table 4?
Hello.
Hi.
Our priority was, I can speak to people who know something about care and support and can make things happen. Particularly we thought around some work, training social work teams again, brokerage, support agencies, all of those groups of people that need to come together to meet support, and we felt that service users needed to be at the heart of that in terms of delivering training and that sort of peer support. There was also another area that came out strongly was around Easy Read, particularly if we're looking at things like CareWise and making that user-friendly and more accessible, and looking at how Easy Read can be used for CareWise as well as other documents.
Thank you. I think that's fairly speaks for itself. Table 5.
Our priority, we looked at active and supportive communities, and our priority was around looking at the communication strategy that we're using to make sure that we reach everybody. There's a risk of everything going online, and that's not delivering information to everybody that needs it. And to be able to focus on early intervention rather than crisis, people need to access the information they need before they get to a crisis. So we need to think about that a bit more. And then the other one was just about bringing intergenerational stuff together and doing more of that work. We'd really like to see that. So.
Yeah, I think it's widely acknowledged that information is available, but it's not always easy to put your finger on it when you need it. So, yeah. Yes. Table 6.
Sorry, did people catch that? It was bring back leaflets.
Oh, bring back leaflets, among other things, yes. Table 6.
We looked at personal budgets and self-funding my money and had quite a bit of debate about processes and systems, but we felt that the most important thing was to actually get the skilled advice and for an individual to plan their care and support and to be able to understand costs and get best value for the money, so they can perhaps group together with other people to actually purchase more. And we did have a bit of a debate about the need to separate out the assessment function and the support planning function within social work, so that we don't actually have to spend more time on assessments, less time on support planning. If it's a separate function, then you know that what you're doing really. Okay.
Yeah. During the personalisation program, there's a talk about making everything sort of a one-stop shop, so people didn't have to go over the same process over and over again. I think we somewhere off from that, but we head in that direction. Well, thank you. There's no at the table. Jackie would follow up here now, please.
Do you want me to hold it? Yes, please. Yeah, when planning this event, we had a bit of a brainstorming session, and the encouraging thing about it is you've all identified many themes. However, food for thought for you to take away, I have a few more for you. Different doesn't mean it costs more. If we can work together smartly, then difference can actually be a strength. Need to join up services with health and transport and that sort of thing. And again, it's about co-production and working together. And although this has been covered, I'm going to highlight it for you to think about a bit more. The challenge to service users to become involved, not only individually, but collectively. Because we appreciate all of you that have been here today, but there's a lot of people out there that haven't been here. So I think it's a role for people in this room to take things away from today and spread that out within the wider community and with service users and their family and friends. And obviously balancing the needs and desires of service users against budgetary constraints. And again, that's been covered slightly, but sometimes, you know, people have expectations that cannot necessarily be met, and it's getting the balance right. Obviously, needing to work amongst all the service delivery groups, including older people, physical disabilities, learning disabilities, and service users, but without just letting those that speak the loudest. We need to make sure that those who do not or who are not able to speak the loudest, that their voice is heard too. And finally, you'll be relieved to hear, recognise the changes and the new players on the scene in terms of health, CCGs and Health Watch. And for those of you that don't know, CCGs are clinical commissioning groups, because as well we need to keep the jargon to a minimum. Thank you.
Yeah, just piggybacking on something someone said a while ago about service users being involved in the training of staff so that you can get better delivery of services. I think that is a key. That would be key. I know in Worcestershire there's a recognition of that. And Worcester make, you know, I have to say this from my experience, they do make an effort. So, and I would just like to encourage the staff to carry on that and just increase your performance, so to speak. Yeah. Yeah, I think so. Unless anybody else would like to make any observation on the day.
I just want to encourage individual service users, organisations and people who are professionals in the care sector to join Whistle. We've got categories of membership for all these different things, and it's important that we share as much as possible so we don't have to duplicate.
Just need to switch that one off, Jim. Is it off? Okay. All right. Well, look at that for timing. 2 o'clock on the dot. How impressive is that? Thank you, ever so much to all of you today, because I do realise that for all of us, time is always a bit of a constraint, but there's been some great conversations. As far as I'm concerned, it's a start. We've got much more to do, but it's a really, really positive start. So thank you very much for your time and your energy today, and look forward to seeing you all again. Thank you.